Heart failure can be prevented if captured early. Early signs might be shortness of breath, swelling in your ankles or belly, early fatigability with usual activities that you once could do very easily. Also, if you have a family history of heart failure, pay attention to it. It's one of the strongest indicators that you also could develop congestive heart failure. And it's completely preventable if we catch it early. Coronary artery disease, arrhythmia, high blood pressure, diabetes, family history all make me think, this patient could have congestive heart failure in their future. And once I start thinking about that, then we start thinking about preventing it for you. Heart failure is diagnosed in the physician's office. You have to see your physician. When you speak with your physician and they do their physical exam, that's when the aha moment happens and they think, this patient may have congestive heart failure. We do some really simple tests then, painless, simple tests in order to figure out if your heart muscle is weakened. An echocardiogram, which is just an ultrasound of the heart, an X-ray, an EKG, which is a heart tracing, and some blood work. Those are the first steps to diagnosing congestive heart failure, and then that can lead to proper treatment. Once diagnosed, congestive heart failure has many, many treatment options. That's why it's important to be diagnosed early, because the earlier we see you, the earlier we can start treating you, and the earlier you're going to feel better. We have medications that are guideline proved. ACE inhibitors, beta blockers, diuretics to help you breathe a little bit easier, and lifestyle changes that will greatly enhance your quality of life. The earlier we see you, the earlier we start your road to recovery. If that's not enough, we have very highly technical pacemakers that can help your heart pump better, and they're easily implanted with just 1 day in the hospital and very, very easy to live with and take care of. If that's not enough, we can move on to advanced treatment options, which would include any clinical studies that we have available, would include artificial heart technology and even cardiac transplantation. Many patients have lived well over 20 years with a brand new heart, only if it's needed, and usually our medications, pacemakers, preventive lifestyle management, usually works for more than 90% of patients. Mass General Heart Center offers comprehensive care for the heart failure patient, from cardiac surgeons to nutritionists, pharmacists, nurses, physicians that are all invested in your health with the latest technology. We work with your community doctor who you know and trust as part of the team to help you and your family understand and treat your condition the best way possible. We simply want you to live well.